back. This is Boomer Life on CL 650.
Welcome back to the program. I'm Sterling Fox, joined in studio by Dr. David Liu from FalseCreek Healthcare Center in Vancouver. Dr. Liu is an interventional radiologist who, along with his teammate, Dr. Joel Gagnon, a vascular surgeon, run an outfit called Eva Vein Care in conjunction with all of their work at FalseCreek Healthcare Center. The perfect guy to ask the most obvious question of the hour. Back to week one at med school again, if you would please, Dr. Liu. What are varicose veins? It's a phrase that I've known my whole life. My grandmother had them. My mother-in-law had them. I've been hearing about it since I was a little boy. So we think we know what this means because we've heard it all our lives. I have no idea what I'm talking about. What are varicose veins?
Varicose veins are very interesting because they've actually been around for as long as we've been standing. Right from the Roman times, where
back to the sandals again.
Back to the Roman sandals.
Okay.
That's right. If you think about a Roman sandal, it's wrapped up around the calf in a crisscross pattern.
Right.
And that's as a result of the treatment, a symptomatic treatment of varicose veins. But fundamentally, what varicose veins are abnormal, diseased veins, generally within the legs and generally within the thigh or the calf. The way that our body works is that there are two different types of blood vessels. There are arteries, which push blood away from the heart.
Right.
And there are veins that return blood from the heart.
Right, okay.
Now, when the veins don't properly return blood, in other words, if the blood becomes stagnant or it sits around, that actually causes a number of different things to happen. It causes the vein to become inflamed, it causes the vein to become enlarged, and subsequently dilated. And once it becomes a certain size, it starts then becoming very tortuous. When we look on our legs, on our thighs, and our calves, and we see large tortuous or twisty veins on the legs, those are referred to as varicose veins. But those are actually only part of the picture.
Tortuous, pardon the interruption, but tortuous as in, that's an adjective to describe appearance as opposed to painful, or does it mean both?
Correct. It's a little bit of both.
Okay.
Because what we try to do is divide the presentation of venous disease into signs and into symptoms.
Okay.
So signs are the things that we can either see or measure, whether it's through an ultrasound, through a physical examination, or through various types of testing or physiologic testing. Symptoms are the symptoms that people have, whether it's soreness, itchiness, swelling, generalized discomfort. So tortuous is actually the perfect term because not only do the veins look quite tortuous, in other words, quite twisty-turny, but it can also be quite tortuous for patients too, not only from a visual standpoint, but also from the symptoms that they experience.
It seems, though, but if I can just follow on the visual for, again, just back to experiences in my personal life, the veins seem to almost rise up to be right under the skin. They're very, very obvious, and they didn't used to be that way. So do they sort of pull themselves forward to the skin level? Is that how that happens?
Well, it's interesting you mentioned that because there's a little twist in the leg. There's a little bit of a twist in the anatomy in that there are two venous systems, two types of blood vessels that bring blood back to the heart. There's the deep circulation, which is buried in the muscles and in the bones of the thigh and the calf, and that's the one that actually returns most of the blood back into the heart.
Okay.
And it works very well because it's dependent upon your calf and thigh muscles contracting whenever you walk or whenever you exercise to push that blood back into the heart.
Okay.
The superficial system, which is also known as the saphenous system, is actually on the outside of the leg, and it's always there. But it only comes out, or it only rears its ugly head when the veins become dilated and enlarged. So they don't actually get pulled up to the level of the skin. They're always there, but when they become
just sort
diseased,
of become visible.
Correct. They become bigger and bigger and bigger until they become visible. And although a lot of the patients and clients that we see feel or present with their varicose veins as something that they just noticed, it's probably been there for years, and it just hasn't reached a threshold of actually being noticeable or symptomatic.
The two prominent people in my life who have talked about their varicose veins endlessly with me were my grandma and my mother-in-law, both of whom it developed the problem, it seems, in their later years. So two questions here. Are women more likely to develop varicose veins than men? And if so, at what point in their lives?
Sure. The short answer is that women actually do have a greater chance of developing varicose veins, and that's for a number of different reasons.
Okay.
The most important is, of course, childbearing. When women bear children, that actually causes a dramatic increase, as I'm sure they can tell you, a dramatic increase in their pressure and water retention.
You did the watermelon thing with me, so do it, please, because it makes perfect sense, especially to guys who never go through this.
Absolutely. So when you add the fluid retention along with the fact that you have a watermelon in your belly that's pushing on everything on the inside,
right,
it causes a significant increase in the vein pressure in your legs, and that can lead to damage that then develops over years
so
after.
The extra weight of carrying this growing child inside you is causing the blood that normally would flow fairly easily up your legs to get pushed around a little
stagnant,
bit.
Pushed around.
Interesting.
Exactly.
So if you have had a child, then you have a slightly greater risk at some future point in your life of developing varicose veins?
That's correct.
What about if you've had more than one child?
That increases the chances of developing varicose veins. We've had a number of patients and clients that we've seen that had a first childbirth without a problem, without an issue.
Okay.
And it's usually only after in those cases, it's after the second child has been born that they've presented with varicosities that they would like to have treated. Now, that's not to say that the presentation is immediately after having children, because there are a number of other issues related to being a woman that do cause increased chance.
It's not an automatic. You have a baby, you're getting varicose veins, deal with it. It's not that cut and dried at all.
Correct.
Okay.
As we age, and especially as women reach perimenopause and postmenopausal periods, our skin becomes a little bit more lax, and so do the walls of the blood vessels. So that's actually another risk factor. Is
the old sagging with age routine you're giving us here, right?
Gravity always wins, unfortunately, and in this case, gravity wins against the veins.
Okay.
And of course, the third component is potentially if that person has been standing for a very long time. So, for instance, if in their professional careers, such as nurses, doctors, or people in the service industry, that additional pressure as a result of the standing blood within the blood vessel for so long can cause a cumulative effect. So you add all three together, and that creates the recipe, so to speak, for a presentation that's much more common in women.
But guys aren't immune. It just doesn't happen as frequently, right?
That's also correct. Another big component of varicose vein development is actually genetic. So people can actually be afflicted with varicose veins as a result of just the family passing down the genes, so to speak, the good, the bad, and the ugly.
So if my grandmother had varicose veins, as she used to remind me frequently, some of my female cousins might be more likely to develop it simply because it's in the family.
Correct. It's like a family heirloom that you don't want, but there certainly is a genetic component to it. And as I was alluding to, many women will present with varicose veins because there's a higher incidence. It's about 3 to 1.
Okay.
But men also present with varicose veins as well, and oftentimes that's either because of genetic predisposition or trauma. So in the case of my father-in-law, he had actually been afflicted with varicose veins for pretty much all his life. He didn't really realize that it had affected his life because he adopted to it. But he never wore shorts in the summer. And those blazing summers in Ontario, he was always wearing pants.
Mm-hmm.
The fatigue in his leg was something that he just put up with, and the swelling was something that was just part of what he had. But being a man, not realizing or not appreciating the fact that this is a treatable condition and men get afflicted with it as well, he really bore the brunt of it for a number of years until he decided to seek treatment. And now he's a very, very happy person. He wears shorts in the summer.
I was just going to say, I bet summers are a lot cooler in his life these days.
Absolutely. His activity's increased, and he's now benefiting from the treatment.
Isn't it interesting, though, how men resist so strongly the notion of, well, you've got something here. You should go see a doctor. Oh, come on. I'm getting on in years. It's what happens. You just suck it up and deal with it. Carry on. And guys will do that, and little realizing in many cases that a visit to the doctor, a chance to see a professional like yourself, could really turn their lives around in very short order, too.
I think one of the biggest challenges is the fact that many people don't recognize venous disease as a real disease. It's an aesthetic problem.
Yes.
It looks bad, but it doesn't necessarily have to be just about looks, because a lot of people have symptoms associated with it. What's happened in our system, at least when I went to medical school, is we would look at varicose veins and venous disease as an afterthought. If your leg's not falling off, if you're not having tissue breakdown, you don't have to worry about it, because the only option is something that's really bad or quite severe, which is surgical resection. So let's just leave it unless it's a problem.
Right.
So people deal with it. But in actual fact, you don't have to deal with it anymore. There are lots of options available.
Well, now let's talk about that. It's it's the summer of 2015, and for a lot of people listening to the program right now, thinking in terms of varicose veins and remedies and possibilities, they're not in 2015 yet. They're looking at and dealing with personal experience. Well, it happened to my sister back in the 90s, and she had a long operation. It was terrible. So talk to us about what you and your team at FalseCreek and Eva Vein Care do that's so dramatically different now in 2015 than from what might be the experiences of many of our listeners.
Sure. Well, I think the treatment of varicose veins really went through historically 4 phases, and it kind of gives you a wonderful storyline to understand how long this has been a problem. As we spoke about in the previous segment, the Romans used Roman sandals to help compress the varicose veins with the leather straps by squeezing them together.
And now they're a fashion statement all over again.
Isn't
that interesting how things come around? Yeah.
Absolutely. And about 150 years ago is when people started operating on the veins and literally taking them out through very large incisions and through what would be considered fairly aggressive maneuvers, like literally taking a pair of claspers or forceps and pulling on the vein as hard as you could until it popped out.
Ouch.
And up until about, I would say, the early to mid 90s, that's the only option that was available.
Mm-hmm.
The third phase, which is really ushering in modern venous treatment, really only started about in the mid to late 90s, and that's with endovenous procedures. And these are procedures where we actually place something into the blood vessel in order to eliminate the blood vessel's function, either by using heat to burn the inside or by using glues or chemicals to help break down the blood vessel and allow the body to heal itself over the vein. Now
can I just stop you, because it sounds like you're doing the same thing as the stripping the vein out in a much less invasive and aggressive way, but the net result is still that vein is no longer functionable. So what happens then to the blood that vein used to deliver back? Do you connect it to another delivery system, or do you just completely take that one out of circulation?
Sure. The wonderful thing about Mother Nature is that Mother Nature will always outsmart us as physicians. But fortunately, within the leg, we have 2 venous supplies. We have the deep venous supply.
Okay, the ones that are more likely to work more often, as you described earlier.
Correct.
Okay.
And then we have the superficial venous supply, which is what we're talking about when it relates to varicose veins.
Right.
So when we close off the superficial supply, the body actually reroutes and effectively reroutes all of the blood supply to the central venous supply.
And you don't have to do anything.
And we don't have to do anything.
Interesting stuff.
Yeah.
Isn't that amazing?
It's amazing to see what the body can do. It's amazing to see how resilient the body is when you can remove a disease state, and this is a perfect example of that.
And because this is certainly an issue with a lot of boomers, this whole business of varicose veins, when people come to you to FalseCreek and they sit down and have these consultations, is it about cosmetics, Dr. David Liu, or is it about, I'm in pain, this is really uncomfortable, let's get this thing fixed? Which of the two is more likely?
We actually see the full spectrum of care. We see everything from minor aesthetic, what would be considered aesthetic problems, which would be referred to as spider veins, to big ropey veins that have been around for 15 or 20 years,
right.
With patients literally having one leg twice as big as the other as a result of the varicosity. And it's important to acknowledge that that actually represents a spectrum of disease. In other words, that small spider vein or telangiectasia could actually represent an evolution into that large varicosity.
If not dealt with when it's still small, right?
Correct.
Okay.
So for the most part, I would say that we see the 2 extremes, which are large symptomatic varicose veins or small cosmetic problems, but we still want to try and identify the root problem if there is one.
Mm-hmm.
The way that I try and describe it to people, and I try to use analogies and stories so that it's a better understanding of our anatomy, is if you think about the veins in your legs as a tree that's flipped upside down. We have a trunk in the middle, we have the roots up top, which is basically your heart, we have limbs, we have branches, and we have leaves. Now, if we have a small spider vein, that may represent a very small leaf, but it doesn't necessarily represent taking out the root or the trunk of the tree.
Of
So
course,
if we trim the leaf off, we know another leaf's going to grow back.
Right.
The problem may potentially be a little bit more central in the trunk or in the root. So as a result of that, any person that does present with venous disease, we actually go through a fairly comprehensive process, including the latest techniques in ultrasound, Doppler ultrasound, polarized light, and physiologic measurements to make sure that if we are going to be treating that leaf, that we're not actually missing the disease within the trunk of the tree.
Yeah, I'll get you to talk a little at length in our next segment about some of these pieces of equipment that you've just whistled through. But the smart part of that answer, of course, is that no matter how small an apparently cosmetic issue may appear, that's still a symptom of potentially something greater. So it's not just dealt with in a sort of an offhanded, oh, we can take care of that. It's seen as, well, we better check this out as thoroughly as we possibly can, just in case it's a lot more than what you think it might be.
Absolutely. What would be considered to a patient a very minor cosmetic or aesthetic presentation may potentially literally be the tip of the iceberg of something more complicated.
Right. Have you had that happen where someone comes in with just a cosmetic complaint that turns out to be significantly more problematic than the individual had thought?
Quite frequently. When people usually present, they present with symptoms, which are things that they feel in their legs that may potentially not be present as signs, such as varicosities, and may only present as a very small spider vein, a 2 or 3 centimeter spider vein.
Right.
And those people are the ones that we really strive to educate and empower so that they understand what's going on, so that they can make the right decisions for themselves as to how they want to seek their treatment or how they want to seek management of their symptoms.
Interesting stuff. Our guest is Dr. David Liu from FalseCreek Healthcare Center. Dr. Liu is an interventional radiologist. I have his business card in my hand, and every time I describe his designation, I have to make sure I get it properly. I was expecting a vascular surgeon, and that's your partner. So it's just fascinating stuff. The team effort that you have organized for EVA Vein Care through FalseCreek Healthcare Center is absolutely fascinating. And there's lots more still ahead, including some of the state-of-the-art new millennium technology available to Dr. Liu and his colleagues at FalseCreek Healthcare Center. And by the way, if you want to check them out, you can do so. They're online at falsecreekhealthcare.com while we take this important time out.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CIL 650.